It's an honor and privilege to meet every single one of you here at One Young World, as it is also to introduce every one of our delegate speakers, but especially so with my speaker, who I get to introduce today, Ceri Davies, who's 22 years old from near Birmingham in England. And at 22, most people have only been to university, perhaps done one or two other things. But Ceri is a student. She's completed her bachelor's in early childhood studies. She's on her way to getting her master's degree. But above and beyond all that, she's a lifelong volunteer. Now, since 13 years old, Ceri has been campaigning for the rights of people who live with disabilities. And also, as part of that, she's the founder of a movement called More Mascots, Please. I think it's very cute that she adds the please on there. She's here today with her supporter on your far left, sitting next to her, Helen, who's from O2 Telefonica. And they've been doing all kinds of partnerships with Think Big and with More Mascots, Please. And what Think Big does also is not just provide funding for people with disabilities, but also gives them the life skills and the development of those and the opportunities, of course, which are so critical to each and every one of us. Ceri's done many things, but most recently, Natalia just mentioned the Paralympics. Ceri was one of the torchbearers during the Olympic Games, and I asked her how it was, and she said, well, it wasn't too bad because I didn't have to get up too early. And it was also near my home. And she says so much, though, and during our brief time together backstage, she talks so much about how she's dedicated, which is a word that we hear very often at this conference, how she's very committed. But when she says it, and when you hear it very, very shortly, you see it also in her eyes, that she's so focused, so determined, and so single-minded about what she wants to achieve, which is to be the voice, to be the representative, not just of people living with disabilities, but the most disadvantaged people in our communities everywhere. She's also extremely modest. She didn't tell me half her achievements, so Helen filled me in quickly. Ceri was one of the 10 people only who was awarded a gold medal by the Princess Diana Award in 2009. And she's also with the Arts Council and is also a very, very effective and influential youth network leader. So it gives all of us great pleasure to hear from you, Ceri, now.
How can I really follow on from that? Good morning, everyone, and welcome to the health debate for One Young World. As I have said, hello, my name is Ceri Davies and I am 22 years old. As you've heard from James, I'm an individual who has completed a degree and is currently doing a part-time master's in youth and community work. I view myself as a community campaigner who advocates youth work nationally throughout my country, the United Kingdom. I am also disabled. My main conditions are cerebral palsy and spina bifida, although I do have more minor health-related conditions. As you've heard, my personal story has led me to become a disability rights campaigner with a positive focus on improving health outcomes and aiding recovery of children and young people when in hospital. My career path has enabled me to represent vulnerable individuals and those who feel they are marginalised within society. When thinking critically about disability, I would certainly urge you, the One Young World ambassadors, to think about both visible and invisible disabilities. A physical example of my own disability is my hands, as you can see, but an invisible example would be the pain that I endure each day. This is why we need to change attitudes so that environments are improved and healthcare staff are trained to care for individuals holistically. The power to support somebody's emotional needs is far too often forgotten about and underrated. From my personal experience and knowing of others in the same situation, we have found this firsthand to be true. 57% of the delegates asked said that certain health conditions carry a stigma attached to them in their country. Ambassadors also consider disability or illness to be the most significant barrier to a person seeking work in their country. We must address these issues because more than 500 million people in the world are recognised as having a disability. but still need to have equal opportunities, it is crucial that this is upheld and implemented, as disabled people have extra barriers to overcome in life, so they're not segregated and debased. I need all of you to stand united and not divided, as things must be changed. As global citizens, we need to put into place effective measures that prevent disability, as we should truly care about the community and see their ability of an individual rather than their inability. I believe that campaigning will positively change people's attitudes from both a social and cultural perspective. When raising awareness of disability rights issues, we need to empower and engage and educate to awaken the consciousness of populations. Attending this One Young World Summit is going to be far more effective than any equipment we could purchase to aid disabled citizens, as together we can make it our business to become more active and educated about the matter. We must understand that life is not a level playing field for all. Using a personal example, when I attend residentials with youth work teams, I require 24-hour care. However, the team make the necessary adaptations so that I can flourish, achieve and inspire others and interact within a level playing field. For future training that could be provided within all health settings all over the globe, it needs to be realised that disability is a complex phenomenon and reflects an interaction between features of a person's body and features of society in which the person lives. If this can be done, then disabled people will experience more fulfilment within their everyday lives, which is crucial, which will lead to their ultimate happiness and positive mental attitude. It will also give them the ability to advocate for others and make change in society, which is the reason we're all sitting here. My overall point throughout this speech is that disability can be made invisible if everyone sees the positive ability of each individual person. It is not the disability that handicaps individuals, but society that unfortunately disables them through lack of education and social ignorance. To make this possible, I am going to suggest to you 3 actions. Firstly, I urge you to go away from here and lobby your political representative about equal opportunities for disabled people. The World Health Organisation strongly advocates the inclusions of disabled persons in every area of social, economical, political and cultural life, and this should result in their true participation. It would be best to do this in memorable capacities and large numbers so that you will be seen as well as heard, and you might even influence their future political career. The second action that I would encourage you to do is network and blog on social media sites such as Facebook and Twitter. 35% of ambassadors asked have close friends or family members that have been affected by a physical disability, and this is why we should improve our health services by promoting it to as many people as possible. And thirdly, my final action is to plan a physical campaign locally to promote disability rights and inclusion. You could do this by creating a physical art form and something visual so people can see it and relate to it, such as drama, dancing and singing. This way of interaction is a very strong and powerful way of communication to get across this very important message. In conclusion, I ask if all of the One Young World ambassadors would stand by me in this pledge and make it a reality so that everyone feels empowered and involved in this movement. I hope I have inspired you to go away and achieve these outcomes so the rights and equality of disabled individuals are promoted.